Hi everybody, I've gotten a lot of questions this week and recently about blepharoplasty and specifically lower eyelid blepharoplasty. And so the questions really are, what is the deal with the under eye bags? What's causing it? How do I treat it? And so I want to go over a couple things with you guys so that you'll kind of understand. Again, I always say it, but educated patients make better decisions. And so with the under eye bags that you see here, what happens is the ligaments that hold the fat, which actually is God-given and kind of protects the eye, cushions the eye in the event of a trauma. It's kind of like an airbag for the eye. But the ligaments that hold that fat up high and tight over time relax. And when that happens, what happens is that the eyelid fat tends to kind of bulge forward, and you can kind of start to see this fullness under the eye. Now, if I push on my eye, you can kind of see that bulge under there. That's exactly what that is. And so it kind of bulges forward. And so what we do with lower eyelid surgery is a couple things really, but number one thing is that we address that fat. That's either removed or repositioned. And that gets into a little bit more of a different discussion for a different video. But the other thing that can be taken care of is that oftentimes we have some excess skin in this area that is redundant and heavy and crepey, and we can reduce that as well at the same time during eyelid surgery. So if you've done any research on eyelid surgery, or even if you haven't, you should know that there are two ways to approach the eyelids and perform this procedure. First way is through a small procedure where I make a small incision just a couple millimeters under the eyelashes. It is a cut in your skin, but it heals really, really well. And I bet you if I showed you a bunch of my before and after pictures, you cannot tell which is it done through the skin or is it done from the inside. The second way to do it is on the inside of the eyelid. I did a couple like these just yesterday. And what that does is an incision on that pink stuff on the inside there. So there's no incisions on the outside of the skin. There are a couple advantages of each approach based on your needs and requirements. So find a specialist who does a lot of this and will educate you and not try to just sell you something.